Some of our research clearly highlights that the clinicians and also the patients needs to think about the mechanical properties of the plantar surface of the foot and also footwear for effective clinical intervention. When clinicians start looking at effective clinical management plan for diabetic foot ulcers and to treat diabetic foot problems, they need to look at the mechanical characteristics of the plantar soft tissues and also either the footwear or the orthoses that they prescribe. Currently, our prescription procedures does not really take into account of the mechanical characteristics of either the footwear or the plantar soft tissues. For effective clinical management of diabetic foot disease and to avoid amputations, one needs to clearly understand what materials they prescribe and the mechanical characteristics of those materials. When we talk about footwear, particularly prescription footwear for people with diabetes, comfort is one of the important parameters. Comfort comes in several ways: the sole of the shoes, the midsole or the footbed, and also the upper. Many times, some of our research clearly shows that the design of upper and the fit of those shoes is extremely important for the patient. Our studies within our collaborative work between here in Staffordshire and in the University of Malta clearly shows that the current clinical guidelines do not take into account of the quantitative evidence which is increasingly being available for the development of screening guidelines. One of the examples is we are not effectively using some of the tissue mechanics, some of the biomechanical parameters that we have developed over the last few years, and we have not incorporated that into the screening guidelines. Our research into the biomechanical properties of the plantar soft tissues, the foot, and the footwear materials have given us an insight into developing effective clinical management tools for diabetic patients. What we've done is to look at individual material properties. Now, we have also developed algorithms in a way that we can develop footbeds for individual patients and we can 3D print it. Our 3D printed footbeds takes into considerations of individual patient specific needs. We have varying stiffness across the footbed, which then meets the requirement of the individual patient. Here at Staffordshire, our work in the area of diabetic foot is multifactorial. We look at some of the prognostic tools by using novel imaging methods and to develop mathematical methods to look at images in a different way. We also look at some of the diagnostic tools like microcirculation and also pressure mat and other biomechanical characteristics. We also have a program of work to look at effective intervention. We have various methods to 3D print footbeds, insoles, and also footwear soles, which then helps the patients.